be brave enough to say, I need a break. Those are simple things that can save your life.
Welcome to At the Heart of It. Hi, I'm Nancy Brown, CEO of the American Heart Association. The COVID-19 pandemic has underscored the urgency around improving our public health system. We have all witnessed the tremendous differences in health outcomes tied to race, income, and other demographic factors. My next guest has worked tirelessly her entire life as a public health expert, from working in rural communities to serving as America's top doctor. I'm also pleased to call her a colleague and a very dear friend. Tune in as she shares her insights on health and taking charge of our lives while also sharing her own backstory and a few doctor's orders.
She's a champion of health and strong advocate for her community. Meet Dr. Regina Benjamin. Dr. Regina served as the 18th Surgeon General of the United States. She is also the founder of the Gulf States Health Policy Center that provides free health information to the community. This Louisiana native has always had a heart for her community. Dr. Regina's impact on promoting healthy communities has reached across the world, from Washington, D.C. to London. She's been named Woman of the Year by CBS This Morning, and she was ranked in the top 25 of Reader's Digest 100 Most Trusted People in America. And you can trust that Dr. Regina Benjamin will help us all live a healthier, happier life.
Regina, thank you so much for being with us today.
Thank you. So good to be here with you, Nancy.
I've got some fun questions to start us off. My signature 5. Are you ready to play?
I think so.
What is the last TV show you watched or streamed?
Well, that's easy. Anything on the Hallmark Channel.
Oh, you and me both.
It has no violence, no politics. It's just good, clean, nice movies and mysteries.
Absolutely. I'm with you there. I'm a big Hallmark fan. What's the last great meal you had?
It's more like dishes, and I think it was one of my family's pot of gumbo. I mean, we just, it's gumbo. It's like not a meal. It's just gumbo.
That sounds like a great meal to me. What's the last song you listened to?
Oh, I've been listening to old music, like jazz and blues. Grover Washington, Temptations. Old time blues down here. So I'm an older person, so I kind of like that kind of older music, dance music, that sort of thing.
You're not that old, Regina, because we're about the same age. So what was your first job?
Probably at home, working around the house, making my mother always made us do things. But first paid job was at a 5 and dime store. And so I was, sort of like a salesperson on the floor. I was in high school, and it was a big deal in our little town because they had not had a black person in the store before, or in many stores in this small town. So that was a pretty big deal. I couldn't keep it very long because we didn't have a car, and it was hard to get back and forth to work. But that was my first job.
Yeah, a trendsetter even back then. What is your superpower?
Oh, superpower. Probably intuition, my own intuition. When I trust it, it works really well, but I have to listen to it. And, it's pretty reliable. So
yeah, very good. And, I can imagine throughout your entire life that intuition has served you very well, including as your tenure as the 18th U.S. Surgeon General. I admired your work so much during that time when you worked at the highest levels of public health. And I think all of us praised the significant accomplishments that were made during your time. But there's much more to your story, Regina. Help our viewers get to know you, the person behind the white coat.
I grew up here in Alabama in a small town out, or a small rural town outside of Mobile. I had never seen a black doctor before I went to medical school, so that wasn't, and I didn't think of it as just, I didn't think I couldn't be a doctor. I just never thought of being one. So the importance of exposing younger people to careers is important. I often talk about how I got involved in pretty much in medicine. When I was an intern, I attended the Medical Association of Georgia's annual meeting. And one of the intense issues that was being debated was that sexually transmitted diseases needed to be taught in medical school. So I stood up in this room with about 15 people or so, or a few more, and I said I'd never seen certain diseases except in a textbook, and I thought there was a need. The Georgia delegation forwarded that resolution to the American Medical Association, and they sent me to the AMA meeting to speak to the issue, and the resolution passed. And within 6 months, every medical school in this country was encouraged to include sexually transmitted diseases as part of their core curriculum. I learned that one person can make a difference, whether it's in medical policy or in medical practice. And I learned that I could make a difference in medical practice when the National Health Service Corps sent me to Bayou La Battery, Alabama. It's a pretty place, but it's a poor place. I found a community of working poor. Too poor to afford medical care, but too rich to qualify for Medicaid. I liked the people and I liked the community, and I wanted to practice medicine there. But I quickly learned that practicing medicine wasn't just sewing up to shark bites. I had to deal with the regulators, reviewers, and all the things that came along with it. And the fact that my prescription pad by itself wouldn't take care of most of the people's medical or health care needs. And so I stayed involved with the community, and from then on have just been involved with everything in particularly community-based medicine.
Yeah. It doesn't surprise me at all to hear you speak about one action, one thing, and how it can change lives for the entire country, because I think that's really a hallmark, that when I think of Dr. Regina Benjamin, I think of tenacity, and what a great story for sharing with us today. And your entire work in rural communities, whether it's providing the clinical care, social services, and health education in the small Gulf Coast towns is extraordinary. You once said, and I'm going to quote, "I hope that we are making a difference in communities by providing a clinic where patients can come and receive health care with dignity." Expand on that for us, Regina. Tell us what health equity is for those who may not be aware, and why is this concept of dignity so important, especially for those most in need?
Particularly when you're dealing with poor or vulnerable populations, they'll go to a place and they feel like people are doing them a favor. Well, they're not. They're going there, and many of these clinics and places that are open are there because of them. And so early days, it was like I wanted to make sure I provided a place where people felt comfortable. They felt like it was home for them. And over time, I think that's kind of what we did. When we talk about health equity, it's not just about being able to have a service or something available. You have to be able to get to the service and all the things that wrap around it. And as we talk about health equity today, it's like, it's not just like it was 10 years ago, which I guess it still is, when we were thinking that affordable care and getting people with access to care, getting them an insurance card was what we thought was the first, or still think is the first step toward eliminating health disparities. It's unfortunately still is, but there's much more to it. There are these social determinants of health that we at the American Heart Association are always trying to emphasize that impact your health just as much. Blood pressure pill, so does your being able to get a job, having an education, you having a clean air to breathe. One of the things we do in my clinic now is trying to address some of those social determinants, and we put on classes for people to learn how to write a resume, how to fill out an application for a job, because we've learned through a number of studies that your financial health is directly related to your physical health. And so just allowing people to be able to improve their status with those, teaching them how to cook healthy, read labels, all of those things improve their health and their health outcomes. We still have to focus on their blood pressures and making sure we're keeping them under control. But they then know why they're doing these things, and that's so important if we're going to make a healthy community.
It's often been said that we have to help by changing the environment around people and then partner with people on their own journey for their life as well as their health, which really can't be separated. And we so admire how you've championed these issues long before people were talking about them. Dr. Regina Benjamin was talking about them. And you also have been at the front of the arrow on many other urgent health issues that I know our viewers care deeply about, including obesity, vaping, mental health, suicide prevention, and more. And I know you know well that the pandemic has made these issues even more pronounced. Tell us what you think about treating the mind and body together, and how can people advocate for themselves? How can we inspire doctors to be more intentional on treating the whole person?
You know, you're really bringing up the fact that as Surgeon General released the first ever national prevention strategy, and that strategy kind of laid out a roadmap on how we can become healthier nation and healthier communities. And if we could follow some of those things, we could decrease some of the leading causes of death, at least at that time. But it all impacts on us now, particularly around what we've seen with COVID-19, particularly around minorities. Were coming into the hospital. They were coming in sicker and dying faster, and than we expected. We knew that people who had underlying health conditions were more vulnerable, but what we didn't think about was that those underlying health conditions included high blood pressure, obesity, and irregular heartbeats. And once we realized that, we were able to start to focus on some of those. But those things were more prevalent in minority communities because of those social determinants of health, not because they were minority, because you see it in other populations as well, rural populations as well, but it was because of these social determinants. And it brought home why we need to have clean environments, clean workplaces, decreasing stress and mental and behavioral health really impacts our overall well-being and overall health of the patient and the community.
Regina, what are you seeing among your patients broadly and even just in general about this whole concept of mental health and well-being right now? When I think of all of the people that I've interacted with on this show, as an example, or just in general in my role at the American Heart Association, everyone's worried about it. CEOs of companies are worried about it for their employees. Physicians are worried about it for their patients. How can we help people, you know, to quote our dear friend Bernard Tyson, you know, you can't disconnect the head from the body. Like, how can we help people think about the whole person? Do you have any secret strategies for us?
I don't have any secrets, or it's basically talking about it and recognizing it. Because oftentimes we, you know, particularly in the past, we would try to push it aside or ignore it. We have to talk about it and decrease the stigma around talking about being stressful. When I first went into my practice, I would have, you know, a patient panel that day, and over half of them would come in and say, "I've got trouble with my nerves." I'm like, what do you mean? My nerves, just my nerves. And in a rural town, we knew what that meant, but people would talk. You need to discuss it, and it was okay to say, I've been having trouble with my nerves. We need to make it easy to talk about. And even ourselves, you know, we don't want to burden our families, burden our friends. You say, "How are you doing?" And the first thing you say, "Oh, everything's okay." Ask a little bit deeper. Be that person that someone can feel comfortable enough to talk to. As a society, we have to be more open about talking about behavioral health. And we have the severely mentally ill, and that's very important. And it's very important that we have policies and funding around that. But we also have the everyday, daily activities of living that also have stress that's involved. And we can't minimize that stress. COVID has brought out a lot of that, but we're seeing more and more people willing to talk about it and be brave enough to say, "I need a break. I need some help. I need a day, just or a minute at a time just to get myself together. Those are simple things that can save your life.
It's so true. And, even before the pandemic, our CEO Roundtable conducted a survey of employees in America. And pre-pandemic, 72% of the respondents of a very diverse study, both diverse in terms of racial and ethnic group makeup, of age makeup, men versus women, 72% of people in that survey pre-pandemic said that within the last 30 days they had felt anxious or depressed. And so you think about how that's exasperated now, and it's really important that with dignity we find a way for people to feel safe to talk about how they're feeling. And I think that also includes our healthcare workers, Regina. There is no doubt that our healthcare workers and caregivers have been so stressed during this pandemic. Tell us what we should understand about what the healthcare community is going through, and what can we do to help?
The stress is tremendous. We're seeing that it's going to be a different way that we're going to have to deliver our care, particularly in hospitals and things. We're going to have to find new ways of doing it because the workforce is so limited. We don't have enough healthcare workforce. And I'd like to encourage many of you to go into health careers, encourage young people to go into health careers, particularly minorities, to go encourage them to enter health careers. But that takes some time. In the meantime, we've got to figure out how do we help our healthcare workforce deliver the care that they're used to delivering in a compassionate way, but relieving them of some of the stresses that they're having every day. I think technology may help with some of that, but we'll have to find ways to relieve some of that stress that our healthcare workers are going through.
Yeah. When we talk about mental health and well-being, sometimes saying thank you to people goes a long way. And I know for me, every time I see one of my healthcare providers, I go over and above to say thank you so much, because I don't think we can ever begin to imagine, if we aren't on the front line, the stress that you described in terms of your colleague and just so many people across the country. And it reminds me of something you mentioned earlier in the show, and that is when you went into medical school, you had never seen a Black doctor before, and you wanted to become a physician. And still today, there are not enough Black doctors in this country. Yet I look back on your career, and you've been a trailblazer. You've broken barriers. You've shattered stereotypes. You've done research. You've discovered treatments. You provide leadership that improves the health of millions. How do you stay passionate every single day? What lights your fire?
Just whatever comes up and needs to be done, you just do it. It has if it's something I can do, I want to make a difference and do it, but also want to encourage others to be a part of that as well, to do that. I want to just say leadership is tough, particularly in times like today, but we lead by example, and that's the first way to lead. And then by service, and that leading by example is a very difficult thing to do at times, but we have to do that, and people look up to us. They'll believe more of what you do than what you say. That really matters. And I think about the number of young people going in health careers. I mentioned about minorities. It's less than 30% of our population is minority, but less than 7% of our physicians are minorities. Same thing with nurses and pharmacists and other health professions, that we need more minorities going into health careers. And sometimes all it needs is a nudge or someone to give them that encouragement that you might want to think about going into health careers. Those are the things that really can make a difference when it comes to leadership. We also, with leadership, we have to which kind of fits into this too, is, when you rise to a level of success, that you don't forget to reach back and pull others up with you. And that's the sign of a good leader. But a good leader, a great leader, will go beyond that and push them out in front of you and let them know you got their back and you stand behind them and make them even better than you are. And so it goes beyond just mentoring or being a sponsor. It goes to standing behind them and encouraging them and supporting them. And when somebody says something out there that you know is the right thing, but it's not popular, we should support them, you know, and give them that support and let them know they're not by themselves.
I love that, Regina. You know, the thought of helping to propel other people over and above your own visibility or success is so key. And I think remembering that there were a lot of people that, you know, have helped us in our lives, and how can we pay that forward is really great. You spoke about leading by example and making sure to put actions, not just words, out. And when I think of you, I think of physical activity and putting action out instead of words. Because one of the first times I met you, we went on a walk together because you, as Surgeon General, were promoting the importance of physical activity. It was really a central theme that you had then and you continue with now. You also have been a real advocate for making sure that there are clinical standards for physical activity so that our healthcare system has the tools that they need. Tell us more about that. Tell us why you believe in physical activity, and how do you think we can help people understand how important that is for their own self-care?
I had this thing I call my journey to joy. It's like exercising, walking, having fun, moving, dancing. I think dancing is a big thing. And I used to talk about having it, possibly have a dance break, just even if you're sitting in your chair and you've been working for a while, just stop and start dancing for a couple of minutes or whatever, even while you're driving, and have fun with it. Even if it doesn't do a lot to make a sweat, it will help your mental health and enjoyable, make you have a happier day. Even during COVID, when you had to socially distance, you could take a walk together. There's so many groups and organizations out there that are doing this sort of thing. We have our American Heart Association walks and things that we have, but Girl Trek is another organization that's walks. They said we can walk as African American women. We could walk for freedom. We could walk for our health, and so let's walk. And those things are just fun things to do, but they do have benefits to them.
Yeah, I love that. I have this great image of you and your friends and family dancing up a storm, which I know you guys do at home, and also this idea of teaming up with other people, which also, of course, helps with our mental health. And when I think about walking and exercise, you can power walk, which is intense. You can meditate and walk, which connects the mind and the body, or you can have fun with exercise like dancing and doing other things. And I have a vision of you in your car dancing around and all the people looking at you as they're driving by, wondering why you're having so much fun.
And even during it as Surgeon General, I would end my talks and making everybody stand up and do it.
I have danced many times being in the audience of places that you were leading. I have a friend and a colleague who shared with me that when she finishes a telephone conversation with you, you frequently say, "I have to go check on my traps." What does that mean exactly? And what else would surprise people to know about you?
Well, it's my crab traps. So I have out on my pier, because I live on the water, and so down here in the Gulf of Mexico, my family's been here since the late 1700s, early 1800s. So anyway, I live on the water, and so I put out crab traps. And so in the evenings, rather than what I'm gonna figure out what I'm gonna eat, especially during COVID, I just go empty the traps and just boil whatever's in there. So that's what she meant.
I love it. There's nothing like farm to table, right? Water to table with a little boiling water in between. Regina, who inspires you? And what is the best advice you have received, and who did that come from?
Oh, all kinds of people inspire me. Nancy, you inspire me. Just watching all the things that you do and being around you has been such an inspiration, and the passion you have. But my mentors in college, some are well-known, some are not. I went to Morehouse School of Medicine, and I was in the second class there. And so Dr. Lewis Sullivan was my professor in hematology and our president and dean, and he became the HHS secretary, and he was always very, very much knowing every one of us. He took us to we'd have dinners at his house. His wife would prepare Sunday evening meals for us. So he and Ginger were mentors. Dr. Francis at Xavier was always right on top, and he knew everything about us, and you didn't want to disappoint him because you knew they had high expectations of you. And back at Morehouse, Dr. Satcher, David Satcher, was my community medicine professor, and he took us out in these communities. We'd have to go into these rural doctors and spend time with them every week, and kind of got me to understand what it's like to be in the community. And I think there also we were amongst a number of civil rights icons, and we got to know them. Not we were too young to realize how important these individuals were, but they did influence us, like Benjamin E. Mays and some of the others that were there. And you learn from them just by being in their presence. And then as you continue and you get in other roles, you want to carry on their work.
And you and I think about all of the amazing people that helped shape your career and who you are today. It's wonderful to just dream about having the chance to be at Morehouse when you were there under the tutelage of such amazing leaders. And I know that all of this experience has allowed you to have such great wisdom. So what is the best advice you have given, and to whom?
I think people should be authentic and true to themselves. And, so just yesterday, someone was asking me, should they, apply for this position, a job, which is prestigious, has a nice name and all that. I'm like, it's great and it sounds good, but is it what you really want to do yourself? Or is it just you want the title and you want the prestige? Or is it what you want to do? And that's a hard decision for some people, because that title and prestige is enough. But I kind of learned a long time ago, you can just create your own title. Nobody has to give it to you. When I opened my office, I just decided whatever my title was going to be. I was president or I was founder or whatever I wanted the title to be. It's what you do that matters. The other thing is to be authentic and true to yourself. Some things may be popular, but if you don't believe in them, don't let other people kind of talk you into doing what you don't want to do. Because at the end of the day, you sleep with your own conscience. And if you do, what you believe in and you believe it's right, it'll always turn out to be okay.
Absolutely. Well, that is so wise. And, Regina, as we close our program today, and we look forward to navigating our overall well-being, what words of wisdom would you like to share with our audience? What doctor's orders would you leave us with?
We have to take care of ourselves. And I would say, get your vaccination and have your loved ones get their vaccination, get vaccinated. I live by one of those sayings that I don't know who made the saying, but some people attribute it to different folks. But it's basically, we make a living by what we get. We make a life by what we give. And I think that's what I'd like to do at some point, is to make a life.
Yeah. Well, Dr. Regina Benjamin, you do that every single day. Thank you for sharing so many insights about you and your past and your beliefs. We all will learn so much from listening to you and really watching you and seeing you in action. You are an incredible force for good. You are a relentless force for good. Thank you for being with us today.
Thank you, and thank you for everything the American Heart Association is doing for our nation, for people with heart disease all over the world. And so I'm just pleased to be a part of it.
Thank you. Thanks, Dr. Benjamin. Have a great day. I so enjoyed our conversation with Dr. Regina Benjamin today. She is not only an amazing national figure and public health leader, but she truly is what you see, a humble person who has learned from her beginnings and who spends every day of her life trying to help people on the front line. I love how Regina talked about the importance of inspiring others to leadership and helping people become even stronger than those who are mentoring them. And the other thing that really stuck with me from Regina's conversation is the importance of helping people feel comfortable talking with you, to give people the dignity that they need in everyday life. Dr. Regina Benjamin is the real deal, and she doesn't just have words, she truly has actions, and that is one of her guiding values as a person and as a leader. I'd love to know what you've taken away from our conversation today. Please subscribe, comment, and share. I'm Nancy Brown. Thank you for joining in.
On the next At the Heart of It, learning the power of resilience.
For me, in that moment of vision loss, the beginning of my career, I really had to say, I can't change what's happened, but I can continue to put one foot in front of the other and move forward.
Find out how to put you first and find the resilience you need. Next At the Heart of It.